Hello, this is Kobe Caravel. It's been a while. The channel has been offline for over a year for a very simple reason. The first video I did that was comparing two Japanese language books was actually taken down to copyright strike. Interestingly enough, it was the company whose book I criticized that gave me that given strike. So that's yet another reason not to buy their books. Yes. Anyhow, I decided to reinstate this channel so I could give accurate information on the ongoing global public health crisis. Words difficult, and I've seen a lot of info online about Japan, articles about Japan, and it's either how Japan is winning this kind of silent war or whatever, or it's how the Japanese are not being careful, there's no lockdowns in place, there's no substantial social distancing. And one thing I've noticed is there is a lack of nuance to these pieces, and I thought that a local perspective could shed a bit of light on what's going on. Giving updates on the situation in Japan, we'll go through data, we'll go through information, and I invite you to ask questions, to make comments. That's the whole idea. And I hope that this channel becomes a window into the archipelago. I've been in Japan for 6 years, give or take, in the Kansai area. I do enjoy life here, and I do want to branch out and make videos about other stuff, more positive, I guess. But given the circumstances and given the impact that this situation is having on everyone, I thought it would be a good restarting point for this channel.
All right, without further ado, let's take a look at the numbers. So as you can see on my screen, Japan doesn't have that many cases of coronavirus. As things stand, and this is March 28th, there's 1,709 cases. Some of those have already recovered, as you can see, the blue number, 404. We've had 53 deaths, which is a relatively low number compared to other nations. Not as low in what concerns mortality rate as other countries, but still quite low. The issue here is with the number of tested. So, as you can see, Japan has tested 28,000 people as of today. I don't have numbers per capita for today, but if we take a look here, and this is our world in data, you can see the reference here on top. In March 19, Japan was at 117 people tested per million people, which is relatively low. Now, these numbers have increased quite a bit, but they are relatively low, or they should be relatively low. And this brings me to what my biggest concern about the situation in Japan is. So the Japanese government's strategy has been to ban big events, basically, and impose some travel restrictions, namely from visitors from abroad. But in terms of domestic movement, there haven't been any lockdowns yet. What we can see in Japan is that people are being warned to be careful and to be vigilant. In terms of case tracking, they've been totally focused on clusters. So they've been going after clusters, and testing has been limited, basically, because of that strategy. And I have some acquaintances that are doctors and nurses, and what one of the doctors that is in the front lines of the COVID-19 has told me is that basically doctors are requesting tests at the hospitals, and health ministry bureaucrats are saying no to those tests, or too many of those tests. And there are reported cases of people dying with pneumonia and not being given a test even post-mortem. So there is a risk that this cluster strategy fails, and if community transmission starts taking place more often, things can spiral out of control very quickly. And given how crowded trains in Tokyo and Osaka are, this would not be surprising. So there's no drive-through testing going through. if you want to test personally, even, with a doctor recommendation is difficult, but if you try to do it by yourself, you'll have to go through infinite layers of bureaucracy, and you'll probably get a negative answer. And this has been reported by many people. So basically, things in Japan are not as good as some people say. If we look at the cases, the daily cases, detected daily cases, so, take these numbers with a grain of salt, because, as I've mentioned, testing has been limited, as you can see here. In new cases by day, we've seen a slow increase at first with ups and downs, and now things are spiking, basically. And if you take into account, if you put this data into context, remember again that testing has been limited. The real number of cases should be much higher. And given that restrictions have not been imposed on movement, and that Japanese corporate world is extremely reluctant in implementing telecommuting or flexible schedules, you can see that this is a potential explosive situation. Most of these new cases have been in Tokyo and Osaka, which is unsurprising. So this last week, the governors of both regions have asked residents to avoid non-essential travel. Let's see if people abide by that or not. But the thing is, the situation is getting worse. And with this standard of testing, we don't have a real picture of what's going on. One last note. This is not because of lack of testing capacity. So Japan is testing way below capacity. This is about the strategy that has been implemented by the Japanese government. Okay. Now talking about how the people are reacting to this and what you see in everyday life in Japan. One interesting thing is that concerning personal hygiene, and this is part of Japanese culture, people have been very careful. So you see people washing their hands, you see people using disinfectant, mask use is pervasive around the country. Many commercial establishments have made available gel and sprays, etc., to disinfect your hands. They've been cleaning surfaces quite extensively. On the other hand, social distancing is simply not a thing. And I think many people in Japan are disregarding the seriousness of this situation. So restaurants are packed more often than not. Bars are packed. Parties are still going on. There have been some cancellations, but people still think it's totally okay to socialize in closed spaces, right? So put this together with the limited testing, okay, with crowded trains and subways, okay, and with the ministry being reluctant to listen to doctors, and you have a potentially explosive situation at hand.